Paranoid schizophrenia. This type of schizophrenia is characterized by the predominant presence of delusions and hallucinations, especially of the persecutory type. It is common for these patients to hear voices. People with this type of schizophrenia may firmly believe that they are being persecuted, watched, or conspired against, even by authority figures, family members, or strangers. For example, they may think that the government is spying on them through electronic devices, or that neighbors are planning to harm them. Auditory hallucinations, such as hearing voices commenting or threatening, are also common and can generate intense fear and extreme paranoia. An example of a famous figure who is thought to have experienced paranoid schizophrenia is the painter Vincent van Gogh, who exhibited symptoms such as delusions of persecution and auditory hallucinations during his psychotic episodes. Hebephrenic or disorganized schizophrenia. Characterized by disorganized thinking and behavior, individuals may have difficulty carrying on coherent conversations, jumping from one topic to another without logical connection. They may show inappropriate emotions or laugh for no apparent reason. An example might be someone who interrupts a conversation about the weather to suddenly talk about aliens without any logical transition. The inability to perform everyday activities effectively, such as self-care or task planning, is also common. Mathematical genius John Nash, played by Russell Crowe in the movie A Brilliant Mind, suffered from disorganized schizophrenia, exhibiting disorganized thinking and behavior, as well as auditory hallucinations. Catatonic schizophrenia. Characterized by agitation or extreme alteration of motor activity, people may experience episodes of catatonia. Catatonia is understood as a behavioral syndrome characterized by an inability to move normally. It includes symptoms such as rigidity, accelerated or bizarre movements, absence of speech, and other unusual behaviors. Treatment includes the use of tranquilizing medications, such as lorazepam, Ativan, and diazepam, Valium, or electric shock, electroconvulsive therapy. These patients show a lack of response to their environment or become completely immobile for long periods of time. They may also show repetitive movements or strange postures. An example would be a person who remains in the same position for hours without showing any signs of activity, or one who constantly repeats the same movements for no apparent purpose. Actress Vivien Leigh, famous for her portrayal of Scarlett O'Hara in Gone with the Wind, experienced symptoms of catatonic schizophrenia, including catatonia and immobility, during her bouts of mental illness. Undifferentiated schizophrenia. This manifests with varied symptoms that do not fit neatly into any of the above categories. People may experience hallucinations, delusions, disorganized thinking, or catatonia, but without the consistency needed for a specific diagnosis. This can make treatment more complicated, since symptoms can be unpredictable and changeable. One example is writer and poet Sylvia Plath, who struggled with mental illness throughout her life and experienced a variety of symptoms, including undifferentiated schizophrenia. Residual schizophrenia. This type of schizophrenia refers to people who have experienced significant psychotic episodes in the past, but who currently show less intense symptoms. They may experience residual symptoms such as difficulty concentrating, emotional blunting, or social withdrawal, although not to the level of other types of schizophrenia. For example, they may have difficulty expressing emotions or taking interest in activities they once enjoyed. But they do not experience delusions or active hallucinations. An example of a famous figure who may have experienced residual schizophrenia is actor Lionel Aldridge, who played in the NFL and later struggled with mental illness, showing residual symptoms such as emotional blunting and difficulty concentrating.